Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. And let's just continue our ethical category and the ethical scenarios that we were discussing. The topic for today's discussion would be medical error and angry patients. Okay, so I'll discuss the medical error first and then I'll move on to the angry patients. And the reason why I'm doing both of these scenarios together because it's very similar and it's just a little modification that you need to do in the medical error structure as compared to the angry patient. Okay, so yeah, medical error. So these are the type of situations in which you would be encountering a patient who may be annoyed, who may be kind of angry with you because you or your team member or any one from the department or maybe the entire department has made some error. And there can be the errors can be of different types, like for example, as seen in this case, you can see that a patient had a biopsy done, and unfortunately you guys have lost the biopsy, and now you have to explain to the patient that okay, you are here to collect your test results, but unfortunately we do not have the biopsy with us. So we're really sorry about that. And then of course the patient is going to get angry, and the patient is not going to be very happy about it because biopsy is a procedure that it's an invasive procedure. It takes some time, it takes some pain, it takes some distress. And then after 2 to 3 days, when the patient is here to collect the results, you're just saying that okay, sorry, we did not even get the biopsy sample, we just lost it. Okay, and then there is another variant in which the patient would be scheduled for a surgery, and the department may have just missed or the lost the blood samples. And then there are some serious cases as well, like for example, despite knowing the fact that the patient is allergic to an antibiotic, one of your team members might have started the antibiotic in a patient, and that error must have led to any complications. Then starting antibiotics without any indication, like they're starting antibiotics for viral fevers and for viral symptoms, just because there was a confusion in the name and two people had similar names, so you just gave the wrong prescription to one person and the other prescription to the other person. Okay, so there are errors like these. Then there is another case in which a patient comes to you with a fall, and then you see the x-ray and then you see reported as normal, but then later on when it is seen by the radiologist or by the seniors, they say, oh, it's a fracture, call the patient back. And then same goes for the ECG as well. You saw an ECG in the A&E and you reported it as normal, but then later on when the cardiologist reviewed it, it shows that it has ST elevation. And then the cardiologist has requested you to call the patient back and then get him admitted and get him treated. Okay, so all of these are like medical errors. These are the medical negligence on your part or on your department's part or your colleagues part. Okay, so you would have to deal with these cases. Okay, and these are the scenarios which usually shows up in the medical error. And when you talk about it, when you share it, the patient is going to get angry, the patient is going to get annoyed, and the patient may just lose his or her calm. And that is what they're trying to see, that are you able to deal with these scenarios, are you able to tackle scenarios like these, are you able to understand what to do in these kind of situation, because this is a real life situation. These are the issues and these are the errors that usually happens in our clinical practice as well. And they're common in the UK as well, because of course the services are run by human and we make human errors. So what if we make any human error like that, and how are we going to uh, share that news or have that difficult conversation with the patients or the relative? And they have to see that how are we going to like tackle it, what are we going to do, how are we going to make sure that we do the damage control. Okay, so that is what the cornerstone of the medical illustration is. Okay, and since it's again a difficult conversation to have, so it can be a bit tricky. That's why we are here to make sure that we provide you with the right structure and the right approach, so that whenever you encounter a patient like this, you know how to handle it, and you would not panic and you would not get under a lot of stress. Why am I saying this? Because the patient can get really angry. Okay, and there is a very strong possibility that they may start shouting at you. They may just pull themselves back and then stand up from the seat, and then they may just be very harsh at you. Okay, And there have been instances in which, because of this kind of the behavior that the simulator showed in the angry patient or the medical illustration, a lot of candidates, they just lost their calm, and because of the anxiety and because of the exam pressure, they started crying as well in the exam. And that is something which you don't want, and you need to be mentally prepared of this, that okay, they can get really really angry, and they may get a kind of rude as well, and they may get very difficult. Okay, so make sure that you are mentally prepared, and make sure that you keep your calm, and make sure that you know how to reassure and how to control the anger and how to manage the situation. All right, so yeah, let's just move on. Okay, so in the medical error station right now, the patient is not aware that okay, the error has been done. So you have to tell them that okay, this is something that has happened, and then the patient would get angry. Okay, yeah. So the introduction would be just the basic introduction, but one thing is very important. Okay, you need to focus on this, because repo building is really really important in introduction. Okay, and you need to have a very friendly introduction as well. This is because you need to make sure that you set the tone all right. You are about to have a very difficult conversation with the patient, okay, or very difficult conversation with the relative. Okay, so you need to make sure that you are starting the station in a very nice way. Okay, you're trying to build a good rapport, because 2 minutes into the station the patient is going to shout at you. Okay, so make sure that the introduction is really friendly, and you do a good rapport building. Then how are you doing right now, how is everything? I can see from my notes that you got a biopsy done. All right, how are you currently doing? Do you have any symptoms? How is your life going in general? Is everything all right? Okay, so make sure that you are friendly, you have a big smile on your face as well, because not because you are just like happy because the fact that you have lost the biopsy, but you're trying to build that rapport, you're trying to build that tone, and you're trying to set that tone for this consultation. Because just think about it, that you are about to have a difficult conversation, and then you start the station in a very very sad, in a very very depressive tone. Okay, this will further like shift the mood of the patient, uh, or very very low on a scale of 10. Okay, and then when you eventually break the error, that okay, this is something that has happened, it will even make the patient even like get more annoyed at you. Okay, because you haven't started off in a very very nice way, and you're not giving a very good vibe to the patient. Okay, so make sure that the rapport building and introduction is done in a very nice way, in a very appealing way. Okay, then in the second layer, what you need to do is that you need to assess the knowledge. Okay, and this is again getting the idea, and you're trying to set the tone. uh, Assessing the knowledge would mean that okay, ask how much idea do they have about their condition. That okay, can you please tell me what idea do you have about your condition? Yeah, doctor, they said that I am having something called the nephrotic syndrome, and it's a problem with the kidneys in which I lose protein. Okay, and if they don't have any idea, just briefly talk about it. Okay, and then ask them what have been told to you so far. And they may just answer, yeah doctor, they said that I need to get a biopsy done to see what kind of nephrotic syndrome it is. And then you gotta ask, okay, what treatment and what investigations have been done for your condition so far. So yeah doctor, they did some tests, they did some urine analysis, they did some blood, and um, as far as the treatment is concerned, they said that once the biopsy is there, we are going to treat you. Or as well, and in other cases, like for example in the cases where you have missed out your on a fracture in an x-ray, then they may just say that doctor, yeah, they just gave me some painkillers after doing some x-rays, and they said that there is no fracture, and some painkillers and muscle relaxant would do. Okay, so they would be giving you some information or the other, that what has happened so far. Okay, now this is basically just assessing the knowledge and trying to get the ice part, that is the idea part of the ice. Okay, that how much they know and how much they are aware of the situation. Okay, so yeah, that is the layer number two. All right, now the layer number three. Layer number three is basically the relevant data gathering that you would do. Okay, and it's pretty simple. There are just few components, and it just applies to every medical error case. Okay, in the relevant data gathering, you can just inquire about the condition itself. Like for example, in this case, we have got um, a patient with probably a nephrotic syndrome and some renal issues. So just ask about the symptoms, that can you please tell me what symptoms were you having? Yeah, doctor, I was having frothy urine, or I was having swelling in my legs. Okay, and then since how long have it has this been happening, and does anything made it better? Is it well controlled? Have you taken any medications for it? Okay, and let's suppose if it's a missed x-ray, then ask about it, that okay, since how long have you been having pain? When did you fall? How did you fall? Do you have any swelling? Do you have any pain on touching? Are you able to walk? Are you able to bear some weight on that particular joint? Okay, so just inquire about the condition. Somebody, with upper respiratory tract infection, you prescribe antibiotics to them because of a confusion of the name. Just ask about, do you have any cough? Do you have any fever? Is there any film that is coming from your mouth while you cough? Since how long have you been having the symptoms? Does anyone in your home also have it? Okay, was there any specific trigger that started these symptoms? Do you have any flu-like illness? Okay, so just a couple of questions regarding that particular medical condition that the patient may be presenting with. Okay, then you may have to ask about the history of the procedure. Okay, like for example, in the case of biopsy, okay, or in the case of blood sampling, you want to ask about it. Like, okay, so you got a biopsy done. How was your experience of getting the biopsy? When did you get a biopsy done? Was it comfortable? Did you go in any distress or something, or was there anything that bothered you during this? Okay, how was the blood sampling experience? Was it comfortable? When did you give the blood? Did you come to the A&E to give the blood, or did you give it at a local or at a nearby GP surgery? Okay, so just ask about the history of the procedure. Why? Because in cases like this, you may have to ask them to get the procedure done again. Okay, and if the patient did not have a very good experience last time, or if the patient had some issues last time, okay, then you may have to sort that issues as well, because otherwise the patient would not agree to give the sample again, get the biopsy again, or get any procedure again. Okay, so ask about the history of the procedure where it is relevant. Okay, for the cases in which the patient was given antibiotics unnecessarily, or the patient who had a missed MI, okay, there is no procedure involved. Okay, so you just ask about the condition and what was done, and you just assess the knowledge, and that should be pretty much it. Okay, then this is the most important thing. Okay, the most important part of the data gathering. If you're not doing this, then your data gathering is extremely incomplete. Okay, what do I mean by this is that number one, you need to assess the complication of the error. Okay, now what is the complication of the error? Let's suppose that you gave the wrong antibiotic in a patient. Okay, and the patient developed anaphylaxis. Okay, so you got to ask about those complications that may occur because of your error. Like for example, did you develop any rash? Did you develop any shortness of breathing? Okay, then let's suppose that if it was a case of mixed fracture or misfracture, yeah, so just ask about, do you have any pain? Do you have any extreme swelling? Okay, missed MI, it can have some serious and some fatal complications. Like, do you have any chest pain? Do you have any shortness of breath at the moment? By any chance, did you lose your consciousness? Are you having extreme excruciating pain in your chest right now? Okay, ask about the complications of error. Okay, for the cases of blood sampling and missed biopsy, you may just ask about different like different possibilities of the error. Like for example, the disease may be just like much more complicated. The disease may have just progressed, so you may just ask about that. Are you able to pass your urine? Do you have any shortness of breath? Do you have any extreme swelling anywhere? Okay, so just ask about the possible complication that your error may have caused in a patient. Okay, so yeah, uh, this is what the main essential of the data gathering is. All right, uh, then what you do is that if you get the time, and if you feel that it's relevant in a particular case, okay, you may just ask about meftosa and p bind if it's a pediatric case. Okay, a lot of medical error may present to you in the pediatric group. Okay, like for example, the antibiotic error and the anaphylaxis risk in a patient that typically presents in a peds group. Okay, so you got to make sure that you're doing the p bind aspect as well, just to cover the ped specific history, just to cover the pediatric history. Okay, so like that is like really really important. Okay, so now you have done the data gathering. Okay, now you have done and you've covered the important questions that you need to ask about the data and about the scenario. Okay, now comes the difficult part. Okay, now I'll tell you what the difficult part is. That is breaking the error. That is talking about the mistake that you or your department has done. Okay, and after you're done with the data gathering, you will be like that. Okay, thank you so much for answering all my questions. I have an important update for you. So, Mr. Adam, I'm really, really sorry to tell you that unfortunately, when we called the laboratory for the lab results, they told us that they haven't received the blood sample or they haven't received the biopsy sample. And a thorough search was done in our department and in the lab as well to find out where the biopsy sample is, and unfortunately we have come to a conclusion that we have lost the biopsy. Okay, and then you're going to remain silent for a while. Okay, because that is something that is going to take the patient, you know, like a step back, and they'll be like, okay, what happened? Why did this happen? Who did this? Okay, and then they'll start being angry. Okay, and the way that they'll be angry, they'll be extremely angry. They're going to say that I cannot believe what kind of incompetent people you have hired in the NHS. How can you do that? And you have just lost the biopsy, and 2 days later you're just coming and you're just telling me that you've lost it. How can you guys be so unprofessional? This is not on and this is not all right. Do you have any idea how much pain I had to go through? Or if somebody was there with a missed mi, then do you have any idea it could have killed me? I could have died. How would you have felt if this was done to your family member or it was done to you? This is not on, and I want to talk to your senior. You are really unprofessional, and I don't know how you even got a job over here. Okay, so they're going to be like really really mean to you. Okay, and they're going to raise their voices. Okay, they're not going to be angry in a very very nice way that okay, I do not understand what has happened. I do not understand who hired you. I do not understand this thing and XYZ. Okay, they're not going to do that. Okay, they're going to be very angry that how can you do that? This is so wrong. This is totally unbelievable. You guys are crazy. How can you miss out on these things? Okay, so please 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 make sure that you are mentally prepared to get to realize this kind of anger. Okay, really important. Okay, now the that the patient is going to show some anger. Okay, and that anger may just lead you to crying in the exam, so you don't cry in the exam. Make sure that you keep your calm and make sure that you let the patient express their emotions. Okay, and once they have expressed the emotion, once they've shouted at you, once they have like shown every bit of anger that they want to, just stay silent till then. Okay, just stay silent till then. Once they're done with that, then you start something called the AF protocol. Okay, now this AF protocol states that okay, so first of all you need to acknowledge. Okay, you need to acknowledge that I can see that you are not happy about it. I can understand you are not liking this at all. I can totally understand that you are not happy about this. Okay, why is this thing important? Because like if somebody try to understand the psychology, if somebody is becoming angry, okay, they want you to acknowledge and they want you to notice that they are angry. Okay, they want you to understand, and they want to make this thing very clear that I being on the other side, I understand that the other person is angry and they're not happy about it. Okay, so acknowledge that I totally understand that you're not happy about it. I can see that it did not come across to you in a very very pleasant way, and I totally understand why you're not very happy about it, or why you're angry. Okay, so really important to acknowledge it first. Okay, that fine, you're angry, I can see that. All right, it's okay, it's okay. Okay, and then the V stands for validate. Okay, this is a very important thing. This is a very very important thing. Just think about it. somebody is being very angry. Why? Because they want to be heard, and because they want to just show the authority that okay, this is something that you've done wrong to me. I pay my taxes. I have all the rights to be angry about all of these things. Okay, so you validate that, okay, and you give the right to be angry to the patient, that you have got all the right to be angry. Anyone in your position would have reacted the same way. Had I been in your position, even I would have reacted the same way. So somebody is being angry, somebody is shouting at you, somebody is being mean to you, to get that authority, to get that power, and to show that authority. And what you are doing, you are automatically handing him over the authority, that you have got all the rights. Anyone in your place would have reacted the same way. Okay, so that is completely okay, the way that you are reacting. Okay, so once you do that, once you've acknowledged it, once you have given that person the authority to be angry, they will automatically calm down. Okay, they will automatically calm down. So you did three things, okay, till the A and V. Number one, you let the patient be angry, you let the patient shout, you just let the patient express out his or her feeling, and you just listen quietly with a silent pause. Okay, and the patient was shouting at you, but you listened very quietly and in a very calm and a very confident way. Okay, that was one thing which was a very very plus point. Okay, number two, what you did was you acknowledged that okay, I can see that you're not happy about it. Okay, that would further help the patient calm down. Then the third thing that you did, that you gave him the authority or give her the authority to be angry. Okay, the authority that that particular angry patient was craving or wanted. That's why they were raising their voice. That's why they were, being very impulsive and being very hard on you. Okay, you automatically gave that authority to them, and then eventually they would be like, okay, fine, I was shouting and I was being rude to impose my authority. They already gave me the authority. This will psychologically, keep the patient down and keep the patient, or keep the relative, make the relative much more calm down in the situation. Okay. And then to further solidify your anger management, not your anger management, but basically the anger management of the patient. Okay, you got to do the E, that is the escalate. Okay, that we are going to take this thing up very seriously. I understand this is something that is an error on our part. Okay, I apologize for it. Okay, I'm really sorry about this. Okay, so you need to apologize as well. I completely missed upon the apology part. Okay, so I would like to apologize for it. Okay, I'm really sorry about this, that this happened. You did not deserve to go through this, and we are going to take this thing up very very seriously. We are going to take this thing up very very seriously. I am sorry that this happened, and I understand that shouldn't have happened. It is completely an error on our part. This is something that is on us, and trust me on this. We are going to take this issue up very very seriously. I'm really sorry that this happened. Okay, be genuine. Okay, and agree to the fact that yes, this was an error on your part. Okay, this is something that shouldn't have happened. This is something that could have been avoided. Okay, so be apologetic about it throughout, even in the acknowledge part and the validation part and the escalation part. And all of these part you need to be apologetic about it. That okay, I'm sorry, I understand that this is an error on our part, but I would like to reassure you that we are going to take this thing up very very seriously. I do understand it shouldn't have happened. We are really sorry about the inconvenience that you have to go through. I understand that the last experience of getting a biopsy was not very pleasant, and I'm really sorry that we missed the biopsy. I'm really really sorry that we were not able to maintain that professional standard. And I agree to our mistake, and I'm going to make sure that we take this thing up very very seriously. Okay, so acknowledge, validate, and escalate while apologizing. Okay, because this is a medical error. Okay, in the medical error, it's a problem that you have created. Okay, it's a problem that has been caused by you. Okay, so you gotta make sure that you apologize. Okay, you are apologetic about it, you say sorry. okay, because this is a problem that has been caused by either you or your department. Okay, so if you do these 4 to 5 things, allowed to express them, acknowledge, validate, escalate, and apologize. Okay, if you do all of these things, okay, then you would be good to go. Okay, and then you would be able to manage the anger of the patient. You would be able to, make sure that the patient is calmed down. All right. Now, in the layer number 6, okay, once the patient is calmed down, when the patient is ready to listen to you, you move to the layer number 6. That is the ethical scenarios. Okay, now, what are the ethical scenarios? Okay, so solutions, sorry. The ethical solutions basically include number one, the first and the foremost thing, that okay, this error has happened on our part. What we are going to do is that we are going to involve our seniors. Okay, I'm going to go and talk to my seniors. Okay, the seniors are also going to come and have a chat with you regarding this. Okay, then the next step in the ethical solution is filling an incident report form. Okay, what we are going to do is that we are going to fill something called the incident report form. Okay, after we've filled an incident report form, what we are going to do is that we are going to do a root cause analysis meeting. Okay, in which we'll try to understand the situation, we'll try to go through the situation again, and we're going to see how and why this particular error happened. Okay, and we're going to prepare a report, and we're going to share the report with everyone and hold the people accountable for the error that they did, so that they are not repeating any issues like this ever again. Okay, so what we're going to do: inform the seniors, fill an incident report form, do a root cause analysis meeting, okay, and then share the report with everyone who is involved, and we will try to hold that person accountable, or hold that department accountable for the error they did, so that they are aware of the mistake that happened, and issues like these are not repeated again. Okay, always try to portray a positive mindset. Okay, that you are doing all of this thing to prevent further errors. Okay, you are not trying to do these things to be a lawyer, or to be to basically like offer punishment to someone. Okay, or just don't go for extreme measures that we are going to fire them, or we are going to make sure that their contracts get terminated, make sure that their GMC registration get cancelled. Okay, do not go to the extreme aspect of it. Do not be negative in your consultation. Okay, on yourself as well. Okay, you need to show that kind of a mindset, that uh, whatever you are doing and whatever the ethical solutions that you are following, the sole purpose of it is to make sure that you improve, and make sure that issues like these are not repeated again. So you got to display that positive mindset. Okay, so always keep that in mind, that you are displaying a positive mindset in this scenario. All right. uh, so yeah, why did I share all of these things? Because a lot of candidates, they just feel that okay, I just involve my seniors, and we are going to, if I just say that okay, we are going to take this thing up very seriously, and we are going to discuss this thing to make sure that something like this doesn't happen, you're not going to get marks on your ethical solutions. Why? Because these are the things that you should be aware of. These are the keywords that you should be aware of. Incident report form, you should know what an incident report form is. Okay, root cause analysis meeting, you should know what a root cause analysis meeting is. It's a meeting in which all the concerned departments and the concerned people are there. They go through the process again, and they try to find out that why a particular error happened. Okay, and how it can be prevented. Okay, so these are the things that you should be aware of. You need to make sure that you are using the terminology incident report form, you are using the terminology of the root cause analysis meeting. Okay, and you are displaying a positive mindset. Okay, not the punishment mindset, that okay, something has happened and we're going to fire them, and we're going to cancel their GMC registration. All right. Then one thing very important in the ethical solution, there is a services called the PALS, that is the Patient Advisory and Liaison Service. Okay, this is the really important thing that you need to verbalize. Okay, the patient is going to say, okay, so there are two possibilities. Number one, the patient or the attendant says that I want to make a formal complaint. Okay, And the other scenario is that the patient may just get calmed down by all the solutions and how you have apologized and how you have managed the anger, and the patient does not want to make a formal complaint. Okay, there are two possibilities. In either of the cases you are supposed to offer PALS. Okay, PALS is basically patient advisory and liaison service. It is basically a service in which the patient can go and discuss their issues. They can provide a feedback. Okay, and if there anything that have annoyed them, or if they've got any grievances regarding the patient care, regarding the nursing care, or regarding how they were treated, okay, they can go to the PALS and they can make an official and a formal complaint. Okay, uh, so for all the issues that are happening in the ward, okay, you need to see that where you are currently. Okay, like for example, in this case you are in the renal unit, that means that you are in the ward. Okay, so for these cases PALS would be relevant. But let's suppose that there is an error that is occurring in the GP surgery or in the GP setting. Okay, then instead of the PALS you need to refer the patient to the practice manager. Okay, yeah, so do not say PALS in case of error in the GP surgery. Okay, make sure that you send the patient to the practice manager whenever you find a medical error in the GP surgery. Okay, so the PALS and the practice manager are the two things that you should be aware of, that these are the solutions to make complaints, to give feedback, okay, to share their grievances, okay, or to talk about the issues that may have come in patient care and in patient management. Okay, now one thing very very important about the PALS that I would like to mention, some of the tutors, they say that do not offer PALS. Okay, unnecessary, do not offer PALS. And the logic that they give is that let's suppose that you or your colleague have made a error, or they have made some they've put the patient in some kind of a problem. Okay, you don't want to put your colleague in a trouble situation. You don't want to put your senior, or you put your department in a problematic situation. Okay, so do not offer PALS, and do not make sure that do not just put them to make formal complaints and to give feedback. Why? Because they would make a complaint against your department, and then the consultant usually don't like it because it's a pretty long procedure, and then the patient, the doctors and the team members have to face a lot of issues then. Okay, so do not offer PALS. Just think about it. If you're working and if your colleague makes a mistake, you're not going to go and make a complaint unless you hate the colleague. Okay, this is what the impression that some of the tutors give to you, and they advise you on not offering PALS to the patient, or not offering PALS to the relative. This is the wrong approach. Okay, this is a very very incorrect approach, because just think about it, this is an exam. Okay, this is not a real life scenario. Yes, in a real life scenario I would not go and ask the patient to make a complaint against my colleague, against me, or against my department. Okay, unless I have some personal grudges against a colleague, and then I could just use the PALS, and then I could just ask the patient to go and report it to the PAL, so that the colleague with whom I have some problems, or with whom I have some issues, they can get in trouble. Okay, in the real life scenario, yes, that works. In the real life scenario, the consultant may just avoid the idea of PALS, because they don't want unnecessary trouble. They do not want unnecessary paperwork and unnecessary meeting, and then unnecessary procedure or process that can be sorted just by an open dialogue between the patient and the medical team. Okay, but this is an exam. Okay, and in this exam, as I always say, that not just your communication and not just your natural approach is being tested, your clinical knowledge and the knowledge about the NHS, okay, is also being tested, because they want to see that are you aware of these facilities that the NHS have. Are you fit enough, or do you have enough idea on what are the things and what are the ways that NHS works. Okay, so you gotta say the PALS. Okay, you gotta let the examiner know that you're aware about what the PALS is. You gotta let the examiner know that you're aware about the escalation to the practice manager. How else is going the examiner is going to know that okay, this person understands PALS, this person understands that what we are offering in the NHS. Okay, until you don't say it from your mouth. Okay, so always make sure that you are offering PALS, and PALS is the first thing that you offer. Okay, always make sure, do not skip pulse. You gotta say pulse. Okay, incident report form, root cause analysis meeting, and pulse. All of these three things are like really important when you are offering ethical solutions to the patient regarding any medical error. Fine, your apology is there, fine, you're acknowledging it, fine, you're validating it, great, but the ethical solution needs to be in line with the NHS practice. It needs to be in line with the GMC management code that have been given to you. Okay, so please make sure that you are offering pulse to the patient. Okay, so yeah, that was what the ethical solution is, but that doesn't stop over here. Okay, now you need to make sure that the medical aspect of it is also covered, because at the end of the day, you are a doctor. Okay, and you got to make sure that you cover the medical solutions as well. Okay, so the medical solutions can be either admission of the patient, like for example, the patient with the missed MI or a missed, fracture. They may need to be, admitted in your care for further management. Okay, uh, then the medical solution may be involvement of specialists, like for example, if you have missed out on a fracture and the radiologist sees it, then you may have to, involve the orthopedic surgeons and the orthopedic team. Okay, then the medical solution may be to, maybe just change of medication or start of a different medication. Like for example, somebody who was about to develop an anaphylactic shock because of the incorrect antibiotic, then you may have to change the medication in that particular case. Okay, and the patient who just got the antibiotic unnecessarily for a viral infection, again you would have to stop the antibiotic, and you would maybe have to put him on antihistamines and just symptomatic treatment. Okay, so all of these are the like medical management. Then you may have to just run some investigations, like for example, in the case of missed MI on an ECG, you may have to do drop, you may have to do an echocardiogram. Okay, and in the case of lost biopsy and the lost blood samples, you may have to run those investigations again, like for example, call the patient back for the biopsy and call the patient back for the blood samples. Okay, so these are the like medical solutions that needs to be done. And what mistake a lot of people do in this particular case is that they completely forget about the medical solutions. Okay, because they think that okay, this is an ethical scenario, and this is correct that this is an ethical scenario, uh, but your entire focus should not just be on the ethics. Okay, you need to make sure that you are not forgetting your role as a doctor. Okay, fine that you are very well aware of the ethical consideration that you need to keep in your mind when you are working in the NHS. That is correct. Okay, but do not forget that you are also a doctor and you need to manage the patient medically as well. Okay, so that is all what the layer number 7 is all about. Okay, make sure that you are offering the medical solutions, the appropriate medical solutions. Okay, now let's move on to the last layer, that is the layer number 8, in which you have to address the concerns. Okay, and in the ethical scenarios that I teach, mostly the layer number 8 is the concerns. Okay, so they may just have concerns, like for example, doctor, I cannot come to the hospital to get another biopsy, I cannot come to the hospital to get another blood sample. Then you can just offer them solution that we can arrange transport for you, or we can arrange an ambulance for you. Okay, or maybe you can just go to the nearest GP surgery, and we can collect your blood sample at the GP surgery, and then the sample can be transported here to the A&E. Okay, offer these solutions. Then if somebody says that doctor, I cannot come to the hospital because I have work, so just try to give them the solution that okay, after your work you can come in the late hours. Okay, and then there is a service, there are some services which are available in the later half of the day, where you can just come and give your blood samples to us. Okay, then the patient you have sent home, who has an MI, who has a mixed fracture, a missed fracture, they may say that doctor, I have got kids at home and I cannot come again and again, that's why I came to the A&E. You should have stopped me there, you should have treated me then and there only. Okay, so you can say that okay, why any particular reason why you can't come, and they're going to say that doctor, I've got kids at home. So you can just give them the solutions that okay, fine that you've got kids, uh, there are caregivers in play area that are here in the hospital, so you can bring them over here, get yourself treated, and then meanwhile you're getting treated, and when meanwhile you're getting assessed, the caregivers and the play area team can look and take care of your kids. Okay. Then they may just share the concern, specifically the biopsy patient, that doctor, last time the biopsy was like really really painful, and I don't want to get it again. Okay. So you got to reassure the patient that, okay, this time we're going to give you some stronger painkillers. And if last time you had a lot of distress, we are going to make sure that, we give you some sedative, so that, you don't feel the distress, and you don't feel the way that you felt last time while getting a biopsy done. Okay. So these are like the different concerns that may come up to you in different cases. But one concern that is for sure going to come to you, okay, that is, how will you prevent this from happening again? Okay. It is most likely that in all of the cases, this is the concern that the patient will definitely throw at you, or the relative may definitely throw at you, that, doctor, how will you prevent this thing from happening? Okay. And you got to answer it in a very very positive way. It should show your positive mindset and your positive intent, that, okay, we will be more careful next time. Okay. We will take measures, and give them examples. Like, for example, if you have missed a fracture, then we're going to make sure that, every time we see a doubtful fracture, we get it reviewed by the radiologist before discharging the patient home. Whenever we see a doubtful ECG, we get it reviewed by the cardiologist before discharging the patient home. Okay. For the in the case of, lost biopsy sample, you got to make sure that, you offer suggestions that, and examples, how you can prevent it, that next time we're going to make sure that we label the biopsy sample immediately, and whenever it is being transported, we make sure that we take receiving signatures from the different departments, so that we can make sure that, okay, the sample have been received by the relevant department. Okay. Same goes for the blood sample, that we are going to immediately label the blood sample. So we're first going to label the vacuum tops, or the tops in which we collect the blood sample, and then go and uh, take the sample. Okay. So just give them those examples. Okay. That, okay, what are you going to do to prevent it in the future? Okay. What are the steps you got to make sure that this particular type of error doesn't get repeated again? Okay. And you would be awarded marks on this, because what they're trying to see is that they're trying to see your positive intent, that, okay, how are you able to improve, and how are you able to, suggest the solutions that will help you improve and your department improve. Okay. So try to make sure that, you give those relevant examples as per the error that has happened. Okay. So where you're going to find them, I just talked about a few of them, but make sure that when you're reading the notes, you try to highlight those examples and those suggestions that, you would, those preventive measures that, you would take to make sure that anything of this doesn't happen again. Okay. All right. So yeah, so this was what the medical error was. Okay. Now let's just move on to the angry patient. Angry patient is it's quite similar. Okay. And the difference between a medical error and an angry patient would be that in the medical error, there was an error. Okay. Because of which, the patient got angry. Okay. uh, and the patient did not know about the error, that, okay, there was an error. Okay. But in the angry patient, there are two possibilities. Number one, the patient is already aware about the error, okay, that has happened, and that is why the patient is angry. Okay. Number one. And number two, there is no error on your part. Okay. And the patient is just being angry because they were not satisfied by a service, or they were not, like treated in a very welcoming way, and they feel like that, a few things could have been better, and they were not. Okay. So there are two possibilities in the angry patient session. Number one, a medical error may have happened. Okay. And that is why the patient is getting angry. And number two, there may not be a medical error involved. You may have you not done anything wrong. Okay. But still the patient may be angry, because there are some patients, there are some attendants and relatives who are generally angry, okay, at the hospital system, and who are generally, angry at the doctor, and there may not be a medical error involved. Okay. So you need to make sure that you identify whether or not there was a medical error or whether or not there was no medical error, and just the patient was being angry for some other reason. Okay, so why is this important? Because the approach would be same, would be very similar, but it wouldn't be same. Okay, there would be slight differences, and I'm just going to talk about those differences, and I'm going to talk about how you're going to switch the layer numbers when it comes to an angry patient, when the patient is angry in the beginning of the station. Okay, all right. Yeah, so in the medical error patient, in the medical error case, okay, the patient was not angry in the very very beginning. Okay, but in the angry patient case, okay, the patient would be angry right from the beginning. Okay, there may be a strong possibility that the layer one that you see, which is introduction and greeting, they may not just allow you to introduce yourself, and they may not just allow you to greet. Okay, as soon as you enter inside the room, they would be boiling with anger that, okay, how can you do this, how can you guys be so unprofessional, this is absolutely crazy, I'm going to make a formal complaint, I'm going to take you to the court. Okay, and all of those things. Okay, whatever the rage is there inside the patient for whatever reason. Okay, they may be that much angry, and you may have to just delay your introduction, delay your greeting. Okay, and jump to the second layer. Okay, that is the AIF protocol, that is acknowledge and apologize. Okay, this is acknowledge and apologize if needed. Okay, so apology only if there was a medical error. Okay, otherwise do not apologize. Okay, if there is a not if there isn't any medical error, okay, in the angry patient case, okay, then you don't need to apologize. Okay, there is absolutely no need to apologize, you haven't done anything wrong. Okay, do not keep on saying that, doctor, oh, okay, okay, Mr. Adam, I'm really sorry that you went through this, I'm really sorry you went through this. Do not say this until there is an actual medical error that is involved. Okay, other than that, just follow the AIF protocol of acknowledgement, validating, and escalation. Okay, so the AIF protocol is literally the same thing. It's just the apology part. Okay, in the medical error, you had to apologize. Why? Because there was something wrong that you had done. Okay, but in the angry patient cases, only apologize if the patient's anger is because of a medical error. Other than that, you're not supposed to apologize. Just follow the AIF protocol. Acknowledge, validate, and escalate. That, okay, we are going to take the issue very seriously. Whatever is causing you anger. Okay, and in order to do this in a smooth way, just add another question. There's an additional question that gets added in the layer number 2 when you're dealing with the angry patient. That is the reason for the anger. Can you please tell me more about it? I can see that you are angry. Okay, I can understand that you are not happy about it. Anyone in your position would have felt the same thing. Let me tell you, Mr. Peter, we are going to take this issue very seriously, but I would want to know what exactly happened. Can you please tell me more about it? So you see, I did not apologize. Okay, in this case, I just said that I can see that you are not happy. I can understand that anyone in your position would have felt the same thing. We're going to take this very seriously, but can you please tell me a bit more about it? Why are you angry right now? I may be able to help you. Okay, try to understand that I'm here to help you. I understand that you're not happy about it. Please share the reason with me so that I can get to the root cause of the problem and try to solve your issue. Okay, and that is how you're going to come to the data gathering. Okay, first make sure that you calm down the anger, and then ask about the reason for them being angry, and then you move on to the data gathering. Okay, in the data gathering, you would have to, as I talked about it, that you would have to ask about the anger, the reason for the anger, and then in the data gathering you may have to ask about this particular thing in the very very beginning. That, okay, can you please tell me what has made you angry? And they may just say that, doctor, uh, you have shifted my husband to another isolation ward. Why have you put my patient in the isolation ward? Why are you treating him differently? Okay, so his husband would be having a MRSA, and this is a communicable disease, and that's why the decision of shifting him to the isolation ward was made. Okay, so they may be just angry because of it. So it's not a medical error. You see, shifting a patient of MRSA to an isolation ward is not a medical error, but the patient is not happy about it. But the relative is not happy about it. That, why have you put him in isolation? Are you trying to treat my husband differently? Okay, So just ask about those, okay, that okay, when did we shift, when did your husband get shift, was the care compromised, was the doctor not visiting your husband in the isolation ward, did the nursing staff treat you differently, did you not did your husband did not get any food during the stay in the isolation ward. Okay, just try to explore that if there was something done differently, or is the patient just angry about the fact that the patient have been shifted to a different ward. Okay, so try to explore the concerns, okay, and the scenario specific questions that you need to ask. Okay, and then once you're asked about that, once you're done asking about that what has made them particularly angry, and then just follow the assessing knowledge layer, that okay, what have been told to you about your condition, okay, what treatment have been done so far. Okay, and then the other parts of the data gathering, you inquire about the symptoms of the patient, that okay, how is the symptom, is it well controlled, anything specific that has happened, since how long have you been having the symptoms, okay, what are the medication that he is taking. Okay, like for example, if it's the MRSA, okay, and the patient was admitted because of the exacerbation of COPD. So just ask a couple of questions regarding this, that does he have any cough, does he have any fever, does he have any blood coming out of the mouth, okay, is he having any shortness of breath, okay, is he doing all right now. Okay, so just a couple of those questions, but the most important part of the data gathering would be in the angry patient would be the specific scenario related questions that you need to ask. Okay, that is exploring the concern. Then the layer is same, okay, the data gathering layer is same that we talked about in the medical error, but the complication of error, okay, this is something that you need to see. Only ask this question if there was an anger because of a medical error. Okay, if there was no medical error involved, then there is absolutely no need to ask about this particular thing, that okay, any possible complication because of this thing happened, because there was no error done. Okay, there was no error in the first place. Okay, so in those cases where there is no medical error, then these question would not be asked. Okay, then do not get into the details of it, but you can just ask about the complications of the disease or complication of the medicine that the patient may be taking. Like for example, this patient has COPD, so you can just ask about the complication of COPD, like for example, by any chance are you having any weight loss, by any chance are you having any lumps and bumps anywhere in the body. Okay, so just so that you're touching up upon the aspect of the lung cancer. Okay, so just to touch upon the complications. Other than that, the complication of error is not very relevant in the angry patient case without a medical error. Okay, then the meftosa and the p bind, depending whether or not it's an adult case or it's a pediatric case. Okay, then explanation of the concern, layer number 5. It's a very very important layer. It may just seem very small and very requiring very less space in this on this screen, but this is a very essential layer. Okay, and what is the explanation? Basically, uh, try to understand that why they're angry. Okay, so in this case the patient was angry because the patient was shifted to the MRSA ward. Okay, and now try to explain that okay, why it happened, that okay, Mr. Anna, I can completely see that you are not very about not very happy about the fact that your husband was sent into an isolation ward, but let me just tell you why it happened. Since we did some tests and we took a swab from your husband, and we found out that he has something called the MRSA, which is called the methicillin resistant staph aureus. It is a kind of a disease which is resistant to treatment with the common antibiotics that we use, and it is something which is highly contagious, and it can become quite dangerous as well. And there are other patients in the ward, and we don't want to put them at risk. So the patients of MRSA, or who have the colonization of MRSA, what we do is that we keep those patients under isolation to prevent the spread of disease, because we don't want other patients to catch a disease like this. So just for the safety of the other patients, and just to make sure that we can give your husband some specialized care, okay, some individual attention, Okay, so try to use the situation. Okay, the wife is angry because she is like that, why did you keep my husband separately? Okay, so try to use the psychology that okay, we kept him separately so that we can give him special attention, because he needs a special attention, because the patient is in isolation, the patient has a communicable disease. So of course, the alarms would be ringing in the head about this particular patient, and you would be giving special attention to him, making sure that there is no contagious element that is left, and there is no contamination that is taking place. Okay, so try to use it. Okay, this is what I talk about PLAP2. Okay, the P in the PLAP2 stands for psychology. Okay, you need to play with the psychology of the patient, you need to play with the psychology of the relative, and the better you are able to do it, the better you would be performing in a particular station. Okay, so that is what the explanation is, that we need to keep him in isolation. And that doesn't mean that we are trying to corner your patient, or we are trying to treat your patient differently. It's just that it's the nature of his condition that requires some special attention, and that is the reason why we have put him in isolation. And I understand your anger is justified, and what you thought was completely justified, but I would like to clear that thing, that it is not exactly what you are thinking. It's just for the safety of the other patients, and just to make sure that we are able to treat your husband all right. Okay, so that is what the explanation of the concern is, and you would have to do it in all the angry patient cases. Okay, let's suppose that if it's an issue because of a medical error. Okay, then this particular layer, the layer number 5, this would change a bit, and in this you wouldn't be defending yourself. Okay, that okay, this is why we missed an MI, this is why we missed a fracture. Okay, and that particular case you would just be apologizing that okay, we are really sorry that this happened, and I'm sure that nobody would want to be in a position that you are in. Okay, so just be apologetic, just repeat the if part again in the layer number 5, if the patient is angry because of a medical error. Okay, in that particular case you cannot defend your self, because if the patient is actually angry because of a medical error, then you're not in a position to defend yourself, because there has been an error that has been done on your part. So in that particular scenario, just repeat the layer number 2, that is the if, just repeat it in layer number 5. Okay, just offer reassurance, and just be apologetic about it. Okay, now the layer number 6. Layer number 6 is just the ethical solution that we talked about. Just to note that if the patient is angry without an error, okay, then there wouldn't be any ethical solutions to offer. Okay, if there is no medical error, okay, and if the patient is just being angry for the sake of being angry, then there is no ethical solutions involved, except for involving the seniors. Okay, that is the only ethical solution that you're going to offer. Just involve the seniors. Why? Because it's a heated conversation that is going on, it's a challenging thing that has happened, the patient is angry. Okay, so if even if you're able to control the anger, even if you're able to handle the situation, just say that okay, I hope that answers all your concern, and I hope that that clears the confusions that you have. But if you still have any confusions and any queries, what I'm going to do is that I'm going to request my seniors to come and have a chat with you. Okay, so that is the only ethical solution that you're going to offer to an angry patient without a medical error. But if it's a medical error involved, then you know the drill, then you know what to do and how to offer the ethical solutions. Okay, and then the medical solutions would be either admission of the patient, okay, involvement of specialists, change of medication, running investigations, change of care, change of management plans, or any referral. Okay, like suppose the patient is not happy with a particular consultant because of any reason, or any thing that they might have not liked about the doctor, or they might not have liked about the nurse. Okay, and there is no medical error involved, and if it's the request of the patient, then you can just change the care of the patient uh, to put him under the care of a different consultant. Okay, so these are the like possible medical solutions that can be offered. Okay, so in the layer number 7, just offer these medical solutions, And in the layer number 8, if despite that, if the patient is having any concerns, then you address that. Okay, so you see that the angry patient, okay, it's very similar to the medical error. Okay, the introduction, the grading is same, the if protocol is the same, the assessing knowledge and concern is the same. The only difference is that in the if protocol, you need to ask about the fact that why they are angry. Okay, then in the layer number 3, you got to ask about the concern specific question, that what has made the patient angry. Okay, and try to explore that. Okay, so that is different. Other than that, the layer 2, layer 3, layer 4 is all the same thing. In just the layer 4, complication of error may or may not be there, depending on the fact that if there is an error made. Okay, layer number 5 is something which is different. In the angry patient, you would have to give the possible explanation of the situation. Okay, and layer 6 becomes optional. Okay, it depends if there is a medical error involved or not in an angry patient station. Okay, so again, it's very similar, but it's not the same thing. Okay, so you need to be very clear on the fact that okay, which layer you need to put first, depending on if it's a medical error case or depending on if it's a angry patient case with error or without error. Okay, so there are like 3 different variants of it, and these are the 2 structures that you need to have in your mind in order to master these 3 different variants and these 3 different type of scenarios that may come to you in the exam. Okay, all right, so that's pretty much it from my side regarding the angry patient and the medical error. If you've got any questions and any queries, drop them down in the comment box below, or reach out to us on our social media. I would love to address your concerns. And if you want to take any one-on-one mock, personalized mock, then scan the QR code for more detail, and we are going to help you regarding that. So that's pretty much it from my side. See you in the next lecture.